Okay, so there's standard baby delivery, and then there's underwater baby delivery. A study by the American Academy of Pediatrics suggests that it could lead to drowning. The chances of it happening are rare, but risks of underwater delivery include infection, difficulty regulating the body, or the baby's body temperature rather, and respiratory distress if the baby inhales water. My goodness. Okay, that sounds scary. What's also scary is that women who are pregnant are not asking the right questions of their OB-GYN, and they should. High-risk pregnancy specialist, Dr. Joseph Adashek, you've seen him here before, is here with more. How are you?
Very good. How are you?
All right, so I'm sure those stories were pretty interesting to you, huh?
Oh, sure. Underwater births. I actually did one once.
You did?
Yeah.
How was it?
It was interesting. Quite interesting.
Yeah, I bet,
actually,
right?
And patients are requesting it more and more now.
Really?
Yeah.
Okay, all right. So let's talk about, there was something you wanted to bring up, Doc, before we actually get into the questions that women should ask?
Sure. Well, before you actually go see your doctor for the first time, you should make sure that they are board certified in OB-GYN, okay? And you can look that by going to the OB-GYN college website. And if this doctor says, oh, I'm a high-risk pregnancy specialist, then you should go to the high-risk pregnancy specialist website and make sure they're board certified not only in OB-GYN, but also maternal fetal medicine, okay?
Oh my goodness.
And if they say they're a GYN cancer specialist, then they should be board certified in OB-GYN and GYN oncology. So all that stuff should be done even before the patient shows up in the office.
Oh my goodness. See, that you have enough to worry about, but board certified is like the biggest deal ever when it comes to medicine these days.
Sure.
Right?
Well, anyone, you know, if you do well in college, you can get into a medical school. You can get into a good medical school. But what really matters then is, where did you go do your training afterwards?
Okay.
You know, I went to Northwestern University. It's a great training program. So then I became board certified in OB-GYN. And then I did a fellowship in just high-risk pregnancies, and then become board certified in high-risk pregnancies. So you should make sure all of that before you see your doctor.
Board certification. Okay. Let's go through the first question every pregnant woman should ask her OB-GYN. What do you say?
Well, I think the number one is, who's going to be doing my delivery? Okay. And is it the doctor you're there to meet? Is it another doctor in the group? And if it's another doctor in the group, well, I have a chance to get to meet that doctor in the group.
Because that's a situation where you need to feel comfortable with the doctor delivering, right? Okay, what's the second question?
Well, I think the second part a lot of people ask is, well, can I have a cesarean section if I want to? A lot of people are interested in just that. And the American College of OB-GYN says it is not a good idea just to do cesarean section on demand. Okay. Now, there are some exceptions to that. If someone, say, is maybe 40 years old, and this is their last chance of ever becoming pregnant, and they want a cesarean section, I'm a little bit easier to get along with in that case. But the more cesarean sections you have, the more dangerous each subsequent pregnancy.
And that could be another segment, Doc, because we were talking about that during commercial break. Okay, what's the last thing?
Well, I guess make sure that who are you going to see every visit that you're there? Are you actually going to see the physician, or are you going to see, you know, a nurse practitioner, or, you know, what's going to happen, say your doctor has to leave for a delivery? Who's going to be there for your visits and there? And also, my opinion, of course, I'm a little bit skewed because I only do high-risk pregnancies with Desert Perinatal Associates, is if you get sent for an ultrasound, where is the ultrasound going to be done? Is it going to be done in a radiology department somewhere, or is it going to be done in a high-risk pregnancy specialist office? Because all we do is, you know, I think we have the best ultrasound equipment. That's what our training is. And God forbid if there's a birth defect, then we can help take care of that.
You know, where were you when I was pregnant? But no, it's, you know, thank you so much for this information, because we are so, I think, focused on the baby getting here that we don't take the right steps, you know, prior to the baby's birth. So, okay, thank you. Board certified. Ask all the right questions. High risk ultrasound, high risk pregnancy, doctor, all this stuff. Ladies, you got that? I hope so. Jason, over to you.
And you were wondering,